The Integrated Regional Logistics Hub represents the first step of a much broader vision of what the CDEMA Coordinating Unit is aiming to deliver for our people. The primary purpose of the Integrated Regional Logistics Hub is to act as both a repository as well as a transshipment point for essential relief supplies and other types of humanitarian supplies to our CDEMA participating states. Essentially, we are able to receive, handle, store, repackage, and distribute essential relief items for our 19 participating states.
When those items are received, we have to tally them to ensure that they are correct. So we will have a manifest of the cargo, and then we also now have to look for the storage. So it says receiving, tallying, storage, identifying the place to store these goods. And because that the cargo is going to different destinations, different countries in the participating states, the cargo had to be stored according to country.
The COVID-19 event accelerated the work that we were doing because there was a genuine requirement to be able to provide in a timely manner essential medical devices and supplies that were intended to reach the people of the Caribbean.
CDB worked with our partners, CDEMA and CARFA, in the region to determine what the need was. And the board of the bank agreed to a financing package of $3 million to purchase the said PPE equipment. This consisted mainly of masks, gowns, protective suits and gloves.
The Integrated Regional Logistics Hub comprises of two main components: the air bridge, which is located at the Grantley Adams International Airport in Barbados, and the air bridge receives items, as suggested, which come via air to the region. The other component is the sea bridge. This is located at the Bridgetown Port and is supported by Barbados Port Inc. And this facilitates the reception of items which are delivered to the region through marine transport.
The Port of Bridgetown was really glad to partner with CDEMA to ensure that, one, we can provide a facility, a warehouse, where we can unstuff containers, process the contents of those containers, repackage them in some cases, and restuff other containers for export, as well as in the form of break bulk, to ensure that these critical items can get throughout the region.
Today we are airside at the Integrated Regional Logistics Hub, and here we have the shipment of WHO cargo. So the idea is that once the cargo comes in, it is consolidated per country. So you will see you have N95 masks and surgical masks, but tomorrow they'll be matched with the UAE shipment, which is on the other side. And that UAE shipment contains coveralls, it contains masks, it contains test kits. Once it is totally consolidated tomorrow, it will then be transshipped to the Caribbean states via regional liners.
What you're witnessing tonight is a large quantity of medical supplies that came through an arrangement between CARICOM, the Caribbean Disaster Emergency Management Agency, World Health Organization, JACMA, and the United Arab Emirates. These supplies will now be handed over to the Ministry of Public Health, and they'll be distributed as necessary in the fight to reduce the impact of COVID-19.
There's a lot of test kits which will allow us to test more persons, and so it will expose the true rates of infection across the 10 regions of Guyana.
This COVID-19 pandemic is a crisis that has impacted the whole planet, the globe. And I think that out of it, we see how we needed everybody, both on the institutional side as well as country side as well as individual side. We needed to react very quickly and adjust and adapt. And so when we saw this pandemic and how we needed to work together, I think we saw that we needed to be flexible. And the support that we're bringing to CDEMA is something that we need to adjust in terms of making sure that we respond to the need as they come. Nobody would have predicted this pandemic and this crisis. So we just said, yes, let's adjust what is needed right now. We need a lot of health supplies and so on. And this is great because it allows, we all need to work together. This is extremely important. Nobody can do it on its own. It's impossible. In this day and age, in this crisis, we all need to partner together.
A diversity of regional as well as international partners have supported the work of the Integrated Regional Logistics Hub. And from the perspective of CDEMA, it is a true demonstration of regional, national, and international collaboration. The key partners have been the Government of Barbados, and special thanks are due to the Honourable Mia Amour-Montley, who supported and facilitated much of the work that was required to ensure that the regulations and administrative requirements around the hub were met in a very timely manner. The Government of Canada, through Global Affairs Canada, provided over 401,000 Canadian dollars in financial support to the operations of the hub. This has contributed to all aspects of the hub operations, including costs of transport, storage, facilitation of transportation and other costs associated with the hub. And we're very grateful to the Government of Canada for their continued support and belief in the region. We also received support from the Government of France through the French Navy. They offered support via the naval installation in Martinique and in fact supported the delivery of relief items to 4 of our participating states: St. Lucia, Dominica, Antigua and Barbuda, and St. Kitts and Nevis.
The World Food Programme as part of a global support to the COVID-19 response is providing logistics services in coordination with the World Health Organization. Now, part of that capacity is around ensuring strategic airlifts from countries and areas where critical health equipment and supplies and PPEs are produced to get them to the different regions around the world. So we're providing that support, airlifting commodities to the regional hub here for the Americas in Panama. And then at the same time, through our partnership in CDEMA, we're helping to coordinate deliveries across some of the small island developing states and all of the CDEMA participating states.
The Logistics Hub actually provided us with an opportunity that we would not normally have, which is to partner directly with CDEMA. And I think that it went very well. We're very pleased with the outcome. So, our first point of entry, of course, will be to strengthen our relationship with the DEM, and in doing so, to be able to, wherever necessary, continue to strengthen relationship with regional partners such as CDEMA.
The future of the Integrated Regional Logistics Hub, I think, is a very exciting one. We wish to have a legacy component of the work that we have undertaken in support of our states for COVID-19. In fact, the hub is up and operational and available to be used for the 2020 hurricane season, should the need arise for us to facilitate movement of relief items to any impacted state. And going forward, we desire that this becomes a permanent feature of the work of the coordinating unit, facilitating the movement of relief items to our impacted populations during their greatest time of need.